It's a Tuesday morning. You wake up and start getting ready for your day. You go to the gym, complete your workout, and then head to the shower. But as you step in, you slip, smashing your arm into the grab rail on your way to the ground. When you look at your arm, you can see that it's broken. While the bone hasn't broken the skin, you can feel where the break is. You scream as you touch it, are hit with a wave of nausea, and start to pass out. Someone else in the gym luckily hears what's happening, finds you on the floor, and calls an ambulance. Paramedics are great. They provide you with pain relief, stabilize your arm, and take you to hospital. But when you get to the hospital, you're told to leave. They don't have time for people like you. Go somewhere else, you're told. But you can't go somewhere else. This is a public hospital. You don't have private health insurance, and ultimately, this wasn't your choice. You didn't intentionally break your arm, and you were brought in by ambulance. You hear the doctor and nurse saying that you probably fell over because you were drunk. Or maybe you intentionally smashed your arm into the wall for drugs, or maybe you just want attention. You remind the doctor that it was 7 a.m. and you've just finished your workout at the gym before you were supposed to go to work, and you've legitimately broken your arm and would like an x-ray so that you can go back to work. It's supposed to be a big week for you after all. The doctor doubles down and asks you about your sleep. How many wines do you drink a night? And if you've been depressed or anxious, before suggesting that maybe you just didn't want to work today. Maybe you're just here in hospital because you're stressed, and this self-harming behavior was so that you could get out of work for the week. The doctor says he's concerned for your safety, and so is calling psych to come and assess you, but agrees to the x-ray for patient reassurance. You are distressed by all of this, but think surely the x-ray will show that you're telling the truth and you'll be okay. You have the x-ray and you hear the radiologist state that your arm is snapped in half and might be surgical. You are relieved because now the doctor will realize his mistake and correct himself. Right? Wrong. The doctor returns and advises the nurse not to provide you pain relief, to remove the splint placed by paramedics since you're actually not injured at all, and that if you try to leave before the psychiatrist arrives, to call security and forcibly sedate you. You've just been placed under a psychiatric hold. You are in agony and crying. You are scared and quite confused. You try to advocate for yourself, but the nurse says that you're being confrontational and calls security. There are now 2 security guards standing at your bedside. You've been labelled agitated and aggressive and told that you're faking your broken arm. Your arm is definitely broken in 2, but if you don't comply with whatever the staff say or ask of you now, you might find yourself pinned to the bed by security, forcibly drugged, and taken to the psych ward, where you aren't entitled to a lawyer or independent advocate to help you access the medical care you actually need. And if you successfully flee the hospital and try to attend a different health facility to treat your arm, the police will be called. This is an extreme example of what happens to people with medical conditions like Ehlers-Danlos syndrome, Chiari malformations, and vascular compressions. And it is what historically happened to people with multiple sclerosis before we understood what multiple sclerosis was. Before doctors had a clear understanding of MS, patients were frequently labelled with hysteria, forced into psychiatric facilities where they were put through violent treatments, leaving them worse off or dead. Just as a diagnosis of anxiety and alcoholism isn't a differential diagnosis to a broken arm, eating disorders or functional neurological disorder diagnoses aren't differential diagnoses for symptoms and test results that indicate a physical cause of symptoms. Yet here we are. And while Australia claims to have some of the best healthcare systems in the world, we are violently enforcing psychiatric diagnoses and treatments at some of the highest rates in the world, even though it is well understood on national and international levels that these approaches overwhelmingly have poor outcomes, cause neurological damage, and are extremely expensive to maintain structurally. We are doing this to people who don't even have a mental illness, purely because the Australian healthcare system doesn't want to treat the actual medical conditions people have. We could do better, you know? It's a choice we make every single day by hospital administrators, doctors, nurses, and allied health professionals. It's a choice to be this violent towards vulnerable people, and it's a choice when oversight bodies fail to act when patients report this happening. You are choosing to be cruel. You are choosing to protect systems that enact that cruelty.